Yep.
I'm Patrick Williamson with the Flowood Fire Department. I've been with Flowood almost 7 years now. I'm a firefighter EMT. Today I'm going to teach y'all about bleeding control. These are our two objectives. We're going to learn today about medical care of a patient with external bleeding, on how to use direct pressure, and also how to use and apply a tourniquet. External bleeding is a hemorrhage, a visible hemorrhage. It's also can be life-threatening. Also, does anybody know how much blood your body holds? Your body holds roughly 5 to 6 liters of blood, which is 8% of a normal adult body's weight. Your body cannot tolerate losing more than 20% of your normal body volume, blood volume. Sorry. It also can affect your vital signs. It can lower your blood pressure, which will also raise your heart rate because your body's trying to compensate for the loss of blood. If you come up on a patient and you see that they're bleeding, you need to address the bleeding first before you go on to worry about the airway and the breathing. Direct pressure is also one of the most effective ways to control bleeding. It helps with the body's normal coagulation to make it occur. These are going to be the beginning of our skills. I'm going to go over these and then I'm going to demonstrate them. First, you want to take precaution. Your minimum precaution that you're going to normally take is just putting gloves on. You also can put glasses on, safety glasses on if you need them. You also want to use a sterile dry dressing, and you want to apply it to the wound. Our next step is we're going to take a sterile dressing like gauze or Coban, and you want to wrap it up nice and tight and firm to help control the bleeding. You also want to make sure you cover the wound in your dressing. You want to go above the wound and also below the wound. If you haven't tied enough and it's still bleeding through, you can also apply some more. You can apply more like 4x4 or an ABD pad, whatever you need to do. We're also going to learn how to apply a tourniquet. You want to apply a tourniquet to the wound site, the bleeding site. You want to place it approximately to the injury. You have different parts of the tourniquet. I'll go over those here when we get to the skills. You want to clip the buckle into place. You also want to pull the strap tight on your tourniquet. You want to turn the rod on there you want to turn it clockwise until the bleeding stops, and also until you do not have a pulse anymore. Now I'm going to demonstrate the skills. First, you want to go, if any of y'all are EMTs, they always tell you want to use your universal precautions first. I'm going to put my gloves on first, which are the minimum precautions that you need to have. While I'm putting these on, once you put these on, you want to also, once you put them on, you want to hold direct pressure to the wound. You can use an ABD pad, or you can use a 4x4. I'm going to use a 4x4. And I'm going to hold pressure to it. While I'm holding pressure to it, I'm going to use my Coban, and I'll wrap it up nice and tight and snug to try to hold. While that, I'm holding pressure on it to make sure it holds in place. And remember, like I said, you want to go above and below the wound. And also, like I said, if it starts bleeding through, you can apply some more, another 4x4, or you can use using a ABD pad that's a little bit thicker. If it still bleeds through, you can apply a tourniquet. This is a cat tourniquet. You have different parts of it. You have your strap, you have your rod, you have your lockdown tab. Also, you want to, this will show you how to apply this. You want to go high and tight is the general rule of thumb. You want to pull your strap down nice and tight. And then you want to twist your rod clockwise until the bleeding stops and until you do not have a pulse anymore. There's also different colors of the cat tourniquet. Cat tourniquet stands for Combat Application Tourniquet. You got black that is for like tactical and combat. You have orange, which is for first responders. Blue, like this, was also for training. It has a 79 to 100% success rate when it's applied correctly. If you don't want to leave it on you want to try to leave it on no more than 2 hours, but if you have to, because long transport times or whatever you have, around 4 to 6 hour mark, you start having tissue damage. Does anybody know what the different types of like blood is? Like you know, you got, if you have like arterial bleed, which is bright red blood, and you may need to use tourniquet for it. It has, like I said, it's bright red blood. Also, has pressure behind it. It's arterial bleed. A venous bleed is a more of a less pressure, but is also a darker red color. You do not want to apply the tourniquet on your head, neck, or torso, or if it's life-threatening. I mean, unless it's not life-threatening. I'm gonna go over what we went over. We went over how to apply direct pressure to bleeding. Also on how to apply a tourniquet the correct way. Also, we've also learned about how much blood volume you have in your body. Does anybody have any questions? I'm going to go through a little review.
So what happens if your tourniquet fails?
You can apply another one if you need to try to see if that helps stop the bleeding.
Where would you apply it?
Since this was high and tight, you would go just below it and try again, you know, put it on the right way, pull it down snug, twist the rod to the clockwise to make sure you get it nice and snug. And you also want, if you want to make sure to stop bleeding again, and also you want to make sure you don't have a pulse. Also, like I said, you want to write that time and date down the strap right here to make sure, so they know the doctor, when you get to the emergency room, they know how long it's been on.
How long is that thing supposed to stay on there?
You want to normally no more than 2 hours, but like I said, you may have, like some volunteers department may have, the ambulance may have a longer transport time. It doesn't need to be on more than 2 hours, but some cases it's on 4 to 6 hours. And if it's on that long, you'll start having tissue damage. Thank y'all so much.